Welcome to the Deep Dive.
Great to be here.
Today, we're tackling a really interesting topic, maybe a bit of a mouthful. Methemoglobinemia in dogs and cats.
This is a long word, yeah.
But what it really boils down to is a situation where their blood struggles to do its most vital job, carrying oxygen.
Exactly. It's a breakdown in that delivery system.
And you, our listener, if you love getting the smart scoop quickly without getting totally overwhelmed, you're in the right place.
We've got some good info lined up.
Yeah, we've gathered insights on the causes, the telltale signs, and really importantly, what can actually be done to help. Okay, let's dive in.
Right. So at its heart, methemoglobinemia is about an imbalance.
An imbalance, okay.
Specifically, it happens when more than, say, 1.5% of the hemoglobin in the blood is in this altered form called methemoglobin.
And hemoglobin, that's the oxygen carrier in red blood cells.
Precisely. The protein that does the heavy lifting. Now, the magic part is the iron atom within hemoglobin. Normally, it's in what we call the ferrous state, or +2. But in methemoglobin, this iron gets oxidized. It loses an electron and becomes ferric, or +3.
Tiny change electronically.
Tiny change. Big consequence. That ferric iron, it just can't bind to oxygen. It can't pick it up.
So it's like the delivery trucks are there, but their loading bays are jammed. They can't pick up the oxygen parcels.
That's a great analogy, actually. Yeah.
That makes sense. But what triggers this oxidation in the first place? Is it something external usually?
Well, it can be. But interestingly, even in healthy animals, a small bit of hemoglobin, maybe around 3%, naturally converts to methemoglobin every day.
Just normally?
Yeah, just as part of, normal metabolic processes. Think of it like a tiny bit of cellular wear and tear or from oxidants produced during normal body functions. But thankfully, there's a system to fix it. Red blood cells have this enzyme called NADH-dependent cytochrome by 5 reductase.
Whoa, say that again?
Yeah. Let's just call it methemoglobin reductase. It's much easier.
Okay, methemoglobin reductase. Got it.
Think of it like a repair crew. It's constantly working, converting that non-functional methemoglobin back to the normal oxygen-carrying hemoglobin.
Keeping things in check.
Exactly. It usually keeps those methemoglobin levels really low, below 1% normally.
So it's like a built-in maintenance system for the red blood cells.
Precisely.
So when this condition, methemoglobinemia, occurs, it must mean either too much of this rust, this methemoglobin is forming, or
the rust removal system, the reductase enzyme, isn't keeping up.
Right. Makes sense. One of those two pathways.
Exactly. Increased production, often due to exposure to oxidant substances, or decreased reduction because of a problem with that reductase enzyme itself.
Okay, so if the blood's oxygen-carrying capacity is hit, what parts of the body really feel that impact the most? Which systems get affected?
Well, several key systems can definitely feel the strain. Obviously, the blood system itself, the hemic, lymphatic, and immune system suffers directly from reduced oxygen delivery.
Right, the core problem.
And if methemoglobin levels climb really high, let's say over 50%, vital organs can start to suffer from what's called hypoxic injury.
Lack of oxygen damage.
Damage due to lack of oxygen, exactly. Think about the brain, the heart.
And you mentioned others.
Yes, the liver part of the hepatobiliary system is also at risk. It can get hit by that general lack of oxygen. Plus, it can be directly damaged by certain oxidant drugs it might be trying to metabolize.
Double whammy for the liver then.
Potentially, yes.
Yeah.
And similarly, the kidneys, part of the renal system, can suffer from oxygen deprivation too. And sometimes, if there's also intravascular hemolysis.
Meaning red blood cells breaking down inside the blood vessels.
Correct. That can add extra stress to the kidneys. So you see, it's not just a blood issue. It can really ripple outwards.
A cascade effect. That helps explain why the signs could be so varied, I guess.
It really does.
Now, we know this affects dogs and cats. But are there specific breeds maybe more likely to get it? You mentioned the enzyme problem.
Yes, and this is where it gets quite specific and really interesting, especially the inherited form. Certain breeds have been identified with a deficiency in that RBC cytochrome by 5 reductase enzyme.
Suggesting it's genetic for them.
Exactly. In dogs, the list includes Chihuahuas, Borzois, English setters, also terrier mixes, cockapoos, coonhounds, poodles, corgis, Pomeranians, pit bull mixes, and even toy Eskimo dogs.
Wow, that's quite a mix.
It is. And in cats, domestic shorthairs have also been recognized with this specific enzyme deficiency.
So if you happen to have one of these breeds, it's just something, maybe something to keep in the back of your mind.
It's worth being aware of, yes. Because their baseline risk, due to genetics, might be higher for the specific cause.
Okay, knowing about breeds helps. But what are the actual signs an owner might spot? What should they look out for?
Right, the signs really hinge on how severe the condition is. In, milder or moderate cases, an owner might not notice anything obviously wrong at all. Possibly nothing striking. But a key sign, if you can see it, is the mucous membranes, think gums, maybe around the eyes looking cyanotic.
Meaning bluish.
Yes, a bluish or maybe even a muddy brownish tint. It's because the blood isn't carrying enough oxygen. But it can be really hard to see this in pets with naturally dark pigmented gums or tongues.
Ah, good point. So it might be missed easily.
It can be. Now, as the methemoglobin level climbs, say above that 50% mark we mentioned,
Then things get more obvious.
definitely, you might see lethargy, just listlessness, an increased heart rate, that's tachycardia, rapid breathing, dyspnea. They might seem uncoordinated, wobbly, that's ataxia, or even progress to stupor, really out of it because the brain isn't getting enough oxygen.
That sounds incredibly serious.
It is. And if levels were to reach something critical, like 80%, it can sadly lead to coma and even death.
Okay, that's frightening. Are there other signs that might point towards why it's happening? Like if they ate something toxic?
Absolutely. If the methemoglobinemia is actually secondary to something else, like a toxicity, you might see other clues pop up.
Like what?
Things like vomiting, maybe they're off their food anorexia or have diarrhea. Sometimes, especially with certain toxins that also damage red blood cells directly.
You mentioned Heinz bodies before.
Exactly, Heinz body hemolytic anemia, where these toxins create clumps of damaged hemoglobin called Heinz bodies. In those cases, you might see hemoglobinuria.
Hemoglobin in the urine, making it dark.
Yes, dark red or brownish urine. And specifically in cats, if they've ingested acetaminophen Tylenol, they can sometimes get subcutaneous edema, like puffiness under the skin, often around the face.
Facial swelling.
Yeah, and maybe excessive drooling, salivation. So these associated signs are really important clues for the vet.
Let's dig into those causes a bit more then. I've mentioned toxins. What are some common household things maybe that are culprits?
Okay, several things that might be around the house or even used therapeutically are known oxidants. Top of the list maybe is acetaminophen again, Tylenol.
A pain reliever.
Right. Also, topical anesthetics containing benzocaine, sometimes found in teething gels or sunburn sprays. Phenazoparidine, a urinary tract analgesic. Even skunk musk has been implicated.
Skunk musk, really?
Yes. And interestingly, those ones, acetaminophen, benzocaine, phenazoparidine, and the skunk musk components, often cause both methemoglobinemia and those Heinz bodies we talked about.
Ah, okay. So they do double damage.
In a way, yes. Other things reported to cause methemoglobinemia, sometimes without Heinz bodies, include things like excess nitrates, perhaps from improperly stored pet food.
Food quality matters then.
It can. And also a medication called hydroxycarbamide, sometimes used in chemotherapy. And then, of course, the other major cause we keep coming back to.
The inherited enzyme deficiency.
Exactly. That deficiency in RBC cytochrome B5 reductase, that's a primary cause in itself, not related to exposure.
So it really could be something they ate, something put on their skin, maybe even something inhaled like skunk spray, or just their genetics.
It covers a range of possibilities.
What makes one animal maybe more at risk than another? We keep hearing about cats and acetaminophen.
You're right to focus on that. Cats are definitely a special case here. For instance, applying benzocaine. If you put it on broken skin or mucous membranes, cats seem to absorb way more systemically than dogs do.
Making the risk much higher for them.
Much higher. And with acetaminophen, it cannot be stressed enough. Cats are far more susceptible than dogs to developing really serious, clinically significant methemoglobinemia.
So the takeaway for cat owners is just never.
Absolutely never give your cat acetaminophen. It's just too dangerous from this perspective. Among others, it's not processed the same way.
Okay.
And then, as we've said, if the cause is that reductase deficiency, well, that's inherited. So certain breeds just carry that genetic risk.
That's a really key aha moment, isn't it?
Yeah.
It's not always about something they got into. Sometimes it's just in their biology.
Precisely. It can be intrinsic.
This is all really vital information for pet owners.
Yeah.
Okay, let's shift to diagnosis. A vet suspects this might be going on. How do they figure it out for sure?
Well, the first hurdle is often distinguishing it from other things that cause similar signs. The big one is just low oxygen in the blood from, say, a lung or heart problem. That's called hypoxemia.
Right, both can cause bluish gums, maybe lethargy.
Exactly, and both can make the blood appear dark when drawn. But there's usually a key difference if you run an arterial blood gas analysis.
What does that show?
With hypoxemia, the actual amount of oxygen dissolved in the blood plasma, the partial pressure of oxygen, or PaO₂, will be low.
Makes sense. Not enough oxygen getting in.
Right. But with methemoglobinemia, even though the blood looks dark and isn't carrying oxygen well on the hemoglobin, the PaO₂, the dissolved oxygen, might be normal or even high.
Oh, interesting. So the oxygen is there in the liquid part of the blood.
It's there, but the main transport system, the hemoglobin, is faulty and can't pick it up effectively.
That's a really critical difference for diagnosis then.
It's a very helpful differentiator, yes.
What about standard lab work, like a CBC or blood chemistry panel? What clues might they offer?
They can provide supporting info. But first, a quick note on the metheglobin test itself. Hemolysis. If red cells break down in the sample tube,
Like if the sample sits too long.
or isn't handled quite right, yeah, that can falsely make the methemoglobin level look higher than it is. So careful sample handling is really important.
Good to know. And the other tests, CBC.
Right, the complete blood count, biochemistry, urinalysis, they can help paint the picture. For example, in animals with that chronic inherited reductase deficiency, you might actually see a persistently high red blood cell count, or HCT.
High.
The body's trying to compensate for the fact that each red cell isn't carrying oxygen as efficiently, so it makes more cells.
Ah, clever compensation.
Kind of, yeah.
Hmm.
On the other hand, if oxidant drugs are involved, you might see anemia, low red blood cells, because those drugs can damage and destroy the cells.
Especially if Heinz bodies are forming.
Exactly. And then the biochemistry panel might show signs of organ stress if things are severe, or if the toxin itself affects organs like elevated kidney values, BUN, or liver enzymes like ALT.
Okay. Are there more specific tests just for the methemoglobin itself?
Yes, definitely. There's a very simple, quick check called a spot test.
Spot tests.
Yeah, you just put a drop of the patient's blood on some white filter paper right next to a drop of normal blood, like from the vet tech or stored control.
You compare the color?
You compare the color. If the patient's blood looks distinctly browner, more chocolatey compared to the bright red control blood, it suggests methemoglobin levels are probably elevated, maybe 10% or more. It's a good screening tool.
Quick and easy, but maybe not super precise.
Not precise, no. For the accurate number, the gold standard measurement is co-oximetry.
Co-oximetry. That sounds like a specialized lab test.
It is. It uses specific wavelengths of light to measure the exact percentages of different types of hemoglobin in the blood, including methemoglobin, normal oxyhemoglobin, etc.
Giving you the definitive percentage.
Right. And remember those baseline levels in deficient animals. Co-oximetry is how we know dogs with the deficiency might range from 13 up to 51% methemoglobin, and affected cats around 44 to 52%.
Wow, quite high even at baseline for them.
Yes. And then, to definitively diagnose the enzyme deficiency itself, you need an even more specialized test measuring the actual enzyme activity in the red blood cells. That's usually only done at research labs.
Okay, so that's for pinpointing the inherited cause.
Correct. And one last thing on diagnostics. If you suspect a toxin, it's really crucial to specifically stain a blood smear to look for those Heinz bodies.
Because they point strongly towards oxidant drug exposure.
Exactly. And they also warn you about potential concurrent hemolytic anemia.
Right, so it seems like diagnosis involves looking at the animal, the history, blood gas, maybe a spot test, co-oximetry if needed, and checking for Heinz bodies.
That's a good summary, yeah. Putting all these pieces together.
Okay, let's talk treatment. What can vets actually do to help these pets once they have a diagnosis?
Well, the treatment really depends on the severity and the underlying cause. For mild to moderate cases, where the pet isn't showing major signs.
Like just slightly muddy gums, maybe?
Right. Maybe a bit lethargic, but otherwise okay. Often, no specific treatment directed at lowering the methemoglobin itself is needed right away.
Why not?
Because the red blood cells have some natural, albeit slower, pathways to convert methemoglobin back to normal hemoglobin over time. If you remove the cause, they can often catch up.
Ah, okay. So if it was caused by a drug,
Step one is absolutely stop the drug, discontinue the offending medication. You'll usually see improvement within about 24 hours as the drug clears out.
that's pretty quick relief then.
It can be. Now, for those animals with the inherited enzyme deficiency,
The ones who live with it chronically.
yes, they often adapt and live pretty normal lives without needing constant treatment. However, a vet might decide to give a single IV injection of a drug called methylene blue right before anesthesia,
Why before anesthesia?
just to try and maximize their blood's oxygen carrying capacity during a potentially stressful procedure where oxygenation is critical, kind of a safety boost.
Okay. What about more severe cases,
Yeah.
where there's anemia involved?
Right. If the anemia is severe or the red cell count is dropping fast, then a whole blood transfusion might be necessary to provide functional red blood cells immediately.
Makes sense. And you mentioned intravascular hemolysis before.
Yes, if red cells are breaking down significantly within the blood vessels, giving intravenous fluids is usually very important to help support the kidneys and circulation.
Right, flush things through.
And naturally, you need to address any secondary problems, electrolyte imbalances, acid-base disturbances from vomiting or diarrhea, support for kidney injury, treating shock if it's present.
So supportive care is key, too.
Very much so. Oh, and one important point. Just giving supplemental oxygen, like via a mask or oxygen cage.
You'd think that would help, right? More oxygen available.
Intuitively, yes. But in true methemoglobinemia, it often has limited value. Because the problem isn't lack of oxygen getting to the blood, it's that the methemoglobin molecule can't bind to it.
Ah, so the trucks are broken? Adding more parcels to the loading dock doesn't fix the trucks.
Exactly. You need to fix the trucks, the hemoglobin, or provide new ones via transfusion.
Got it. So directly addressing the methemoglobin itself is the key in severe cases. Are there specific drugs for that? You mentioned methylene blue.
Yes, methylene blue is the main one. For significant, life-threatening methemoglobinemia, it's considered the drug of choice.
How does it work?
It essentially acts as a cofactor, helping another enzyme system within the red blood cell reduce the methemoglobin back to functional hemoglobin much faster than normal. It's given as a 1% solution, usually slowly, intravenously,
And does it work quickly?
often quite rapidly, yes. You can sometimes see improvement, like the gum color getting pinker, within about 30 minutes.
That's impressive. Are there any downsides or precautions with methylene blue?
There are. We need to be a bit cautious because methylene blue itself, especially at higher doses or in certain situations, can actually cause Heinz body formation and potentially hemolytic anemia.
Oh, ironic. The treatment can cause a related problem.
It can, particularly in cats who are generally more sensitive to oxidant damage, and also in animals that already have Heinz bodies from the initial toxin. So we use it carefully at the correct dose.
Okay. What about that acetaminophen toxicity in cats? Is there something specific for that?
Yes, absolutely. For Tylenol poisoning in cats, there's a very specific and highly effective antidote called N-acetylcysteine, or NAC.
MAC.
It works by replenishing glutathione, which is a crucial antioxidant that gets depleted by acetaminophen metabolites in cats. It's most effective if you can give it really early, soon after the cat ingested the Tylenol. There's a specific dosing protocol for it.
So time is critical for that one.
Very critical. Generally, for treating methemoglobinemia itself, there aren't major contraindications if the animal is severely affected. But that precaution about methylene blue and Heinz bodies is the main one to keep in mind.
Right. Monitor carefully.
Yes, if methylene blue is used, especially if Heinz bodies were already present, we definitely want to monitor the red blood cell count, HCT, for maybe 3 days afterwards.
Why 3 days?
Because sometimes the anemia associated with Heinz bodies can take a couple of days to fully develop. You want to make sure you catch it if it occurs.
Okay. Are there alternative drugs besides methylene blue for general methemoglobinemia?
Not really in common veterinary practice for acute severe cases. Methylene blue is the standard go-to. Research explores other things, but clinically it's the main player.
Understood. So after treatment starts, what does the follow-up care look like? What are vets watching for?
Well, the most obvious sign of improvement is watching that cyanosis fade. The gums and mucous membranes should start looking pinker as the methemoglobin level drops.
Back to a healthy color.
Exactly. And doing that spot test again can be helpful. The blood drop should return to a normal bright red color, indicating the methemoglobin is likely back below that rough 10% threshold.
Visual confirmation.
Yep. And as we just discussed, if methylene blue was given or if the underlying cause involved Heinz bodies, then monitoring that HST, the red cell count, is really important for a few days.
To catch any delayed anemia.
Precisely. You want to make sure that doesn't sneak up on you.
This has been incredibly informative, really clearing up a complex topic.
That we could walk through it.
So just to recap for everyone listening, methemoglobinemia is this condition where the blood's ability to carry oxygen gets impaired because of a specific change to the iron in red blood cells.
Right, the shift from ferrous to ferric iron.
It can be triggered by various toxins, common household items even, or sometimes it's an inherited enzyme issue in certain breeds.
Leading to a whole range of signs depending on severity.
And diagnosis involves careful observation, specific blood tests like blood gas and co-oximetry, and looking for related issues like Heinz bodies. Treatment depends on the cause and severity, ranging from just stopping the trigger to using specific medications like methylene blue or NAC and providing supportive care.
That covers the key points well.
You, our listener, hopefully now feel you have a much deeper understanding of this condition, from what's happening at the cellular level right through to how vets approach diagnosis and treatment.
It's a fascinating intersection of chemistry and physiology.
It really is. And finally, just to leave you with something to think about,
Mm-hmm.
considering all the different causes we've touched on, especially the oxidant exposures, what common things in our pet's environment, maybe everyday household items, might pose a hidden risk that we don't immediately connect with this kind of problem?
That's a really good question to ponder. Makes you look around the house a bit differently.
Definitely something to keep in mind. Thank you so much for joining us for this deep dive.
My pleasure.